when we're talking about being triggered, what we're really talking about, whether it's anger or or anxiety, we're talking about the kind of reactivity which is related to, what Daniel Siegel calls the amygdala hijack. Excuse me, Daniel Goleman calls the amygdala hijack, and Daniel Siegel calls flipping your lid. Wow, let me try that again. We're talking about the amygdala hijack, which is coined by Dr. Daniel Goleman in his book Emotional Intelligence, and then also the idea of flipping your lid. And so we're going to show you a little bit what that is and how we can manage it. So when we talk about triggers, we're talking about self-regulation, and that means impulse control. That means verbal impulse control, emotional regulation, and behavioral control. So inside the emotional centers of our brains, in the middle of our brain, the emotional brain, is the limbic system. And inside the limbic system lives the amygdala. This is a pretty old organ in our brains, and it acts like the brain's alarm system, setting off the fight, flight, or freeze response. When the amygdala senses danger, real or imagined, it jumps into action and tells the rest of the brain and the body to run from danger, to fight it, and sometimes it shuts the body down. So what we want to really understand is that the amygdala actually perceives danger before our thinking brain. So there's, the reptilian brain, the physiological brain, the emotional brain, the mammalian brain, and the human brain, the thinking brain. And the emotional brain, the amygdala, which is pretty deep in there, and some people think is, very old, even and is connected to that, to sort of our ability to, act before we think, essentially. That's what the amygdala does. So we're acting in defense. So what happens is our amygdala, the information goes through our eyes or through our ears, and the amygdala senses danger. Sometimes we might perceive that physically as well in terms. So when the amygdala activates the danger reaction, what happens is that the brain is flooded with, adrenaline or cortisol. And it takes about 5 to 7 seconds for that to happen. The brain is flooded very quickly. What happens during this time, this is when you feel a rush of adrenaline, a faster heartbeat, shorter breathing. It's that knee-jerk reaction within milliseconds of sensing some sort of disturbance. When the amygdala becomes activated, the thinking brain, your prefrontal cortex, goes temporarily offline and feelings rule the day. In neurotypical brains, executive functioning skills help the amygdala calm down by engaging language and perception and regulation, to name what's happening instead of just experiencing them, to be able to step back and assess the situation and find solutions. In ADHD brains, because executive functioning skills generally are somewhat more compromised, there are often more challenges than strengths. These executive functioning skills, already working so hard to accomplish and maintain daily life tasks, struggle with the extra burden of effectively dealing with that rush of strong emotions. So people will react quickly with volatility instead of responding with consideration and perspective. What's interesting is that the process of excitement is also something that actually runs right. It's sort of the two sides of the same coin, because we're also flooded with adrenaline, but this time it's, much more of a positive kind of experience. So when we talk about our triggers, what we're talking about is this idea of how are we going to improve emotional control. Now, strong emotions highlight what's important, and they cue us to pay attention. And the brain attaches emotion to experiences to help us prioritize them and figure out what's needed to stay safe. Safety is our goal, okay? Safety is our goal as humans. Emotions can obviously be shared through facial and bodily language. ADHD brains often struggle with turning on or turning off emotional processing and actions, which can lead to flooding. So you have, your amygdala, the information goes in and your amygdala senses danger, and then it's a flooding of the brain. The brain isn't able to sort of kind of look at it and see what's happening because those executive functioning skills are overwhelmed. So in ADHD brains, emotions can build under the surface until they stand out so much that they can't be ignored, excuse me. They could be annoyed. So this is a separate situation. So one of the things that happens is so there's the situation of, oh, I'm in a situation where I'm facing a danger, but there's also a situation in which I'm like really angry. Something is triggering me, something is tipping me off. I'm very worried, I'm very angry. Emotions are building, and then boom, you're flooded. So what we want to understand is that either way, the chemical reaction in the brain is very similar. So I like to think about triggers in terms of different categories. So I do green, yellow, orange, and red. So in the green, it's when you're in the flow, things are working. I call this is sort of your baseline. You're calm, you're comfortable, there's control over you feel like you have control over your thinking and your attention. Level 1 is the disturbance in the field. It's that yellow zone. The feeling is mildly present, but it's ignorable. You can identify what's happening, like maybe it's a negative voice in your head, or you might have limiting beliefs compared to facts, or you're thinking, something is a little bit off, I'm not sure what it is, but I'm starting to feel a little agitated, okay? And level 2 is the alert system. The orange level is the alert system is activated. You're feeling uncomfortable. It's harder to ignore those feelings. It's harder to disengage. You're starting to feel a little overwhelmed. You might be ruminating a little bit, some thoughts about what's going on. And level 3 is high alert. There's now total focus on whatever the feeling is. It is now taken front and center. It's when that thinking brain kind of goes offline. Your emotions are ruling the day. It's impossible to ignore your feelings. You want them to stop. There may be physical symptoms present and a certain kind of flooding. When you're in high alert, your body is ready to fight or flee. Your muscles tense. There's more shallow breathing to get more oxygen to your blood. Digestion slows down, so that's why you might feel nauseous or get diarrhea. Your heart is racing to send blood to your muscles so you can flee or fight. There's blood flow away from the front of your brain, the prefrontal cortex, to the amygdala. And there might be perspiration to cool your body down because you're heating up. So a physical response is called for in high alert. We want to change the situation that you're in to prevent an inappropriate reaction like yelling at your kids or losing it at work. So often we're holding our breath, we're not inhaling, we're not exhaling, we're very tense. And this is why in my 5 C's, the first C is self-control. And that self-control has to do with breathing. You're putting that oxygen mask on yourself. You're breathing in, you're breathing out, and you're using particular types of breathing, whether that's alternate nostril breathing from yoga, whether that's smelling the flower and blowing out the candle, whether that's what I call triangle breathing. You breathe in for 4, you hold for 4, you breathe out for 6, you pause when you're empty, you breathe in again, you do that several times. So when you are on high alert, a physical intervention is what's called for. When you are in the orange range, in activation, you want to get out of the situation, but you don't think you should. And so you're fighting emotions. It's kind of like the feeling of swimming upstream a little bit. The emotional thinking and that rational thinking, they're kind of at war with each other. So we want to engage the language centers of the brain to turn down the volume of those emotional centers of the brain and to turn up the rational centers. So this is where we can use healthy distractions, self-soothers that you've planned in advance. I'm going to go to the bathroom and wash my face. I'm going to take a walk. I'm going to have a drink of water. I'm going to, you know, go to my room and do a couple stretches, or I'm going to break out yoga for the family, something like that. So these are where we use self-soothers that are comforting and compassionate for ourselves and for those of you who are parents, for our kids. And finally, for the third level, the last level, which is, you know, before we have the green level, but the yellow level, a disturbance in the field. So this is when you talk back to the negative voice, particularly when we're talking about anxiety, that's telling you, starting to sort of tell you these comments that something that you're not okay, or the situation isn't okay, and these may not be actually, this danger may or may not be justified. It could be imagined. And so you want to shift your your focus to your rational, experienced brain, your wise inner self. And so in these moments when you're starting to feel the disturbance, when you're starting to feel agitated because your kid still doesn't have their shoes on and we've got to leave for school or you're going to be late for work, or you yourself are in a situation where someone you're in your car and someone is driving too close in the back, they're riding your tail a little bit, that's anxiety provoking. You want to think about what you're going to say and so that would often mean in this phase thinking about someone who loves you, what they would say to you. If you were talking to a child with a skinned knee, what would you say to yourself? We have to engage at any stage of the triggers, except the flow when you're like feeling good, ways to soothe ourselves. Because one of the things that doesn't work with triggers is reassurance and minimizing. So our tendency with kids and sometimes with partners or with ourselves is to say, oh, you'll be fine, don't worry about it. I actually went to the dentist today and, struggling with a little issue in my house, and my dentist was like, oh, don't worry, it'll be fine. And I thought to myself, that is such the wrong thing to say, and you have no idea if it'll be fine because you don't live in my family. You don't know. What would be better to say is, it sounds like it's really challenging. Yes, that's a validating statement. But when he said, oh, you'll be fine, it just irritated me, even though I know it was coming from a good place. So we want to remember that when we're triggered, or when someone else is triggered, trying to reassure them that something is going to be okay when you don't have any idea if it's going to be okay, or letting them know it's not that big a deal when it's a big deal to them. Both of those things are like throwing fuel on a building fire. Okay, so I'm going to take a pause here, and I would like to ask you, what are things that trigger you, and what are some triggers that you're seeing in your family? So what are some things that trigger you, and what are some things that trigger your kids? Joanna says you recommend the CPS method from Ross Greene. Ross Greene is a genius. I love his work. His collaborative problem solving inspired me to do my 5 C's, and collaboration is that third and very important C, that middle C. There are a couple questions here. Desiree, I got angry. Let's see. I get angry. I take things so personally. My son was kidnapped by my sister, mother, and other family members. Oh my God, Desiree, that sounds awful. Of course you take things personally and you get angry. You are not a failure. It sounds like you're a victim. Let's see. You're welcome, Anna. Thank you, Sean. You're welcome, Dina. Deanna, how would you advise to help identify these triggers in an ADHD kid who's only 10? Okay, this is a great question. So here's the thing about kids with ADHD. They know that they get set off. And they actually have some idea of things they like and things they don't like. They have ideas of things that make them mad and things that make them feel good. That's the conversation I would suggest having with your 10-year-old. What kind of things really make you mad at home? What kind of things make you mad at school with your friends? What do you do when that happens? Is that effective, or do you like how that goes? Would you like to try something else? So we want to brainstorm with them by meeting them where they are and helping them think of something to do or say in those situations. It's very important to have a phrase in your back pocket when you don't know what to do. What is your go-to? And we're going to talk about that in a minute. Let's see, I have a couple. Let's see, kids back talk is a trigger. Oh, Deanna, I hear you on that one. It is a huge trigger. And you really, what we have to do in those moments as parents is put on our Teflon suit and not take that in. I used to say to my kids, fresh is for vegetables. And they would roll their eyes like, oh, mom, you think you're so cool. And I would be like, I am so cool, because that is the coolest thing to say. But it's hard. It's very hard because kids know how to push that invisible button. It's actually red right here. It's not so invisible. It's invisible to the rest of the world, but for kids, it's like blinking red, and they just push it to get under our skin. So when kids talk back to you, it's good to know that if your kid does that a lot, whether or not how you want to engage with that. What do you want to say? Do you want to say, would you like that to be your take back of the day? We've talked about that here before, that everybody in a family can have a take back of the day, something that they wish they didn't say. Or you can ask them, why, you can say, is that something that you really want to be saying right now? Or you can come up with something that's a little lighter, like, yeah, that's a good back talk comment, way to go. Something that actually meets them exactly where they are. April, my kid's not listening. That is also very triggering. You're talking to them and they're pretending like they can't hear you. Sometimes it's like the teacher in the Charlie Brown cartoons. Wah, 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 wah. That's what they imagine that you're saying. That's how they act. So when we want our kids to listen, we want to make eye contact, give the directions with the rule of 3. I have a lot about that on my website, so check it out. Philip, when my spouse is lecturing me on what I didn't do right. Ooh, I hear you. These are all so good. I want to high five everybody. Yeah, like I have to say, when my spouse lectures me like how I should load the dishwasher because the plates should go like one way, they get cleaner than the other way, which may or may not be my experience, to be perfectly honest. It kind of grates on me. I'm like, it's the dishwasher. Who cares, right? So when our spouses, our partners are saying things to us about what we didn't do right, we want to press pause on that conversation and say, hey, I'd like this to go better and a different way. So what we're going to do is we're going to stop how this is going because this isn't making me feel good and it's not helping change the situation. And instead, I would move right into reflective listening. They get, 3 to 5 minutes to tell you what, they want to say, and you reflect back what you hear intermittently. You raise your hand like this to say you heard, but you need to reflect back, or you can, they can pause, and then you do the same. So you have a chance for them to understand that you heard them and for you to speak and feel heard as well. Militia, I feel triggered when I feel unheard. Yes, many people do, whether or not they have ADHD. We as humans, we want to feel seen and heard, particularly by our loved ones. So when we're not feeling heard and it's triggering us, what are our options in that situation? Do we need to ask the person to repeat what we're saying if it's a child, for example, or a spouse or a sibling? Or do we need to sort of take a step back and just kind of circle around and come back and say, I'm not sure you really understood what I was trying to say. And we can do that in the moment too. Heather, I feel triggered when my kid doesn't listen, is defiant, or rude to me. Of course, everybody feels triggered in those moments. Those are the moments when you really need your oxygen mask because that's what kids are supposed to do. Kids are testing limits. That's their job. And our job is to manage ourselves in the face of those tests. And I'm going to tell you, I did not always do a very good job. In fact, sometimes I lost it. And I have lost it. And it's really hard to hold it together when you're being triggered, when you're being provoked. And so that's why we want to get into how we want to communicate that to others and what we want to say to ourselves. My goodness, there are so many comments. When what someone says doesn't match their body language or actions, right? So there's a confusion about that. When my son raises his voice, okay, so there's a theme about kids yelling at adults, kids being disrespectful, kids not listening. We'll come back to that. Lost a library book yesterday and couldn't think of anything until I found it. Nothing else. Hyperfocus. Sounds like it, Susan. My odd son gets under my skin. Disrespectful responses. Yep. Joanna, my husband, undiagnosed, and I, diagnosed of a child, are often triggered by our 5-year-old when he does something to hurt us or trigger us, and we ask him to stop, and it's done again right away. Growing up with ADD, I understand and sympathize, so I don't want to be repeating, why don't you listen? But I can tell it is on us to cope better in these moments. Right, so when your 5-year-old, who, we know that the ADHD brain matures more slowly, maybe younger than, may not have the executive functioning skills of his peers who are 5. In fact, most likely he does not. He's younger in that way. And so if he's unable to manage himself, then in a calm moment, you want to talk about what the strategies are going to be for those moments when he is not stopping. And sometimes if kids they stop and then they do it again and they stop and they do it again, obviously there's something underlying. So we want to try to get a sense of what that is. So one of my clients taught me something called stop, stop, breathe. So I really like this. You're going to take a pause. Then you're going to stop again, because sometimes it takes 2 stops to stop, and then you're going to breathe. Because your son is showing you that he can't manage what's happening in his life with the resources that he has available and the skills that he has. When my husband plays mind games, when my teenagers think it's okay to say cuss words in my house, my kids get triggered by me nagging them when they first walk in the door. Okay, thank you for saying that. Yes, it will be available in the replay. Take back of the day. You got it. Lori, wow, what an insight about the negative effects as that well-meaning attempts to be helpful, such as minimizing and reassuring, are, in reality, to the person dealing with emotional dysregulation in that moment, adding fuel to the fire. That makes sense. When I'm fired up and others minimize or reassure, it makes me see red, white, in turn, makes me feel guilty and ashamed that I blast them when they're trying to be helpful. Right. This is great. I'm so glad you're saying this, because, Lori, the thing is that it's very dismissive. I think minimizing and reassurance are both kind of dismissive in a way, because they're not validating or acknowledging the reality of the concern that you have. So instead of, we have to find something else to do instead of blasting, because we want to remember that when people are minimizing or reassuring, they're trying to help. What they're saying is, I care about you. I don't know what to say or do that would be helpful, so I'm saying this other thing. And so what I'm trying to do in my life when people do that is I say, thanks for your caring, because that's really what we're talking about. Joanna, I personally have trouble finding a moment to think ADHD and weigh options once a trigger occurs. It's hard not to impulsively react. Yes, absolutely. I also want to apologize for the typos. My keyboard won't backspace properly on this page for some reason. No worries. Very understanding group here. Sarah, especially when they're so into their electronics, it's very frustrating. Yes, it is. 2 ADHD teen and preteens arguing and setting each other off is a major trigger for adult mom. Oh yes, and they can be so annoying to each other, and then you're witnessing this and you just kind of want, peace in the house, right? So how can you kind of tune that out in a way, because they have to figure out their relationship for themselves. Parents really, The onus is on parents to intervene in sibling relationships when there's some danger, when there's a danger of a physical danger, and if there's a kind of a particular bullying or emotional abuse, then we want to intervene. When siblings are arguing and setting each other off on a regular basis, I think that what would be helpful is to have a family meeting where you actually talk about this pattern and how you could interrupt it more effectively as a family. Anastasia, my kid being triggered triggers me. I know that he is acting out of overstimulation or anger, but sometimes my brain overrides me. Yeah, it's hard to see our kids struggle. It's really, really hard. Tanya, thank you for this. I live at home with a brain injury in recovery, learned about my ADHD diagnosis after I got sober. Good for you. My parents are therapists, so they feel like they are authority and tend to minimize my experience. They use language like boundaries, but also call me dramatic and shut me down. My RSD feels a bit out of control. To be honest, I feel like I'm drowning in this situation, not sure what to do. Tanya, big hug to you. I'm so sorry. It sounds like you're living at home because you're recovering. And I actually think that setting some boundaries with them would be great because you're an adult and they're trying to, you know, tell you what's right for you. So maybe sit down and clarify some areas with them where they have some influence and areas that are off limits. Okay, I'm not odd, sorry, ODD. Thanks, Teresa. Philip, I was diagnosed with ADHD at 50. 3 years ago. It's been difficult retraining all those bad coping skills I've developed over time, not knowing why I was doing this. Of course, it's going to be hard to retrain yourself from that. Don't get down on yourself for that. It's like, you have a habit. That habit is well ingrained. It takes time, patience, and repetition to change habits, and a lot of attention. So give yourself a little break. Pick one thing you want to work on. One. We can usually change one thing at a time. And that's where a lot of people with ADHD and without kind of mess themselves up because they try to change several aspects about themselves and you can't. This year I'm working on not interrupting my husband. It is totally driving him crazy. And part of the reason I interrupt him is because he's a bit of a long talker. I've told him this, but it doesn't matter because it drives him crazy. So we've worked on is for me to say, I need to call pause in this conversation. Can I say something? Because, or I'd like to say something so that instead of just interrupting, he can, kind of be warned that he's been talking for a while and then I have something I want to say. And I'm going to tell you, it is so hard. I have a lot of work to do. Michelle, my kids agree to tell me or hear, or to agree to or tell me they hear me. They simply neglect to do it as asked. Right. So I think if you're telling kids to do something, then we want to be clear that that we mean it and that there's an incentive that's like attached to it. There's like a incentive and a consequence. Like, hey, I need you to this so we can that. And to give them, to count for them, that's a 1. That's a 2. When we get to 3, if you haven't done it, the consequence that we agreed on is going to happen. So you may not earn that extra computer time you want. Okay, Philip, you have a teen in the house with ADHD, clash of the titans. Put on your armor. Teresa, I'm a single 64-year-old mother with a 25-year-old special needs child. I am his only support and caregiver. We both have ADHD. The only emotion he knows is anger. I tried very hard not to trigger him. Sometimes I think he triggers me on purpose. That may be true. He may trigger you on purpose because the anger is an intense form of connection. Let's face it. When people are angry at each other, they are engaged in something together. He also may be very frustrated with his life, and you are the safe place to take that frustration out. So it's difficult for you and for him. I'm wondering, I'm hoping that he has someone to talk to or other supports, and if he has a physical outlet. You're welcome, Tanya. Yeah. Yeah, that's exactly right. influence and then off limits. Um, Deanna, ADHD combined with ODD in a child, how to make them listen to what I say. So this is interesting. So the research actually shows that to treat ADHD travels with oppositional defiant disorder at least 40% of the time. And treatment for oppositional defiant disorder and ADHD is a combination of medication and family therapy or parent training. And with that combination, things can often get better and really better within 2 years. So what we want to do is we want to be able to when we want your kids to listen, because a lot of times they're not listening because they're running a conversation in your head about what they think you're saying to them, or they have a reaction to the first 3 words that you say instead of the whole thing. So I do think it's important to use that rule of 3. Make eye contact, state what your request, have them repeat your request twice. The first time just is rote memorization. It's that short-term memory. The second time is that working memory, because now they're going to think about what they have to do that request. And then when he does the request, to appreciate him for it. It may sound counterintuitive. Not bake him a cake, but to say thank you, or I really appreciate that you did that. I really like when you blah, blah, blah. That can be very helpful. Often ODD is a relationship problem. Kids don't feel seen or heard, or they have anger about other areas of their life, often school, that they can't express, and they bring it home and take it out at home because it's a safe place. One kid told me, I can't be expelled from my family. So that's kind of what we're thinking about here. Okay. Cassandra, hi. My kids will start a conflict when they're seeking stimulation. Conflict is the quickest way to create dopamine. It can be so frustrating even when I understand what they're doing. Yes, that's a really good point. Conflict creates energy, right? So when that cortisol races through the body, you're all revved up, and that's a high dopamine. There can be a high dopamine experience because there might be rewards for being that stimulated, like you're going to get attention, or you're going to be able to let out some of the frustration that you're holding. Joanna, maybe think of ways they can help and ways they cannot. Like, I'd appreciate it if you could remind me about the upcoming due dates, but I'd feel more comfortable with relying on my own alarms and reminders for daily tasks. Great. If my mom went overboard reminding me about something and then went further to try to even take the reins with getting me ready to do it, it was infantilizing. Exactly. But high priority reminders here, they're actually helpful. That's great. Cecilia, hi. My son is 18 and gets upset at me when I ask to borrow his items when I can't find my items. For example, if I ask him to borrow his phone charger, he tells me no and yells at me. Okay, so he's trying to set a boundary with you, and so I'm wondering if you can have, like, a backup phone charger. So one that you keep in the same place every time. In fact, I think if you are losing things and you're asking him to borrow them, it would be great to have a home for your main things, your phone charger, your wallet, your keys, etc. And things go there every time. That way, I think you won't ask him, because in some way, I think what's happening is he feels like now he has to kind of help you with your ADHD, and he doesn't have the wherewithal yet to do that, the compassion or the empathy. The 5 C's, the 5 C's, Susan, self-control, compassion, collaboration, consistency, and celebration. I'm not sure what you mean by where they have influence and where it's off limits, Tanya. I don't understand. So what I'm saying is, you're an adult living in your adult parents' house. So what are the areas that would make sense that they would have some influence? And it would probably on things that would be, you'd have influence with any kind of housemates. And that might be, the cleanliness of the house, food, where not leaving your stuff around the house, things like that. If you need assistance with making appointments and getting to appointments, then that's a different level of intervention and support. And then you want to ask them specifically for when you need that assistance. Okay, so I want to go to, like, what do you say to other people when you're triggered about yourself, that you're actually feeling triggered? Deanna, compassion, is that something to expect from my teen or something that will come from time? I wouldn't expect compassion from your teen, but you want to direct compassion towards your teen. And the compassion is meeting them where they are, helping them accept the brain that they have, and not criticizing yourself for not being perfect, and helping them not criticize themselves for not being this, that, or the other thing. So what do you say to other people about yourself when you're triggered? And I have some suggestions here. One is, I'm not comfortable with the direction this is headed. Can we start over? That's kind of like a take back of the day, but it's a little like more cushiony. I'm feeling a bit overwhelmed. Let me get back to you. Let's pause for a moment and regroup. I need to use the bathroom. So those of you who've been coming to this group for a while know that the bathroom and going to the bathroom is one of my favorite interventions, because you go to the bathroom, every human being uses the bathroom. You close the door, whatever's happening on the other side of that door will still be there, and you can take a few minutes to pull yourself together. Maybe make, an SOS phone call to somebody, or, say something to yourself in the mirror that's encouraging, or just wash your hands, just to arrive to cool yourself down so that you can use your thinking brain when you open the door again. The last suggestion that I have is, this is upsetting me and I'd like to settle for a minute before we continue. So I had someone have one of my children, we were in a conversation, and they said, I'm getting upset right now. I want to hang up. I'll call you back in a few minutes. And I was thinking, oh yeah, you're going to call me back? Sure. And they did. It was really cool. And they said why they were getting upset. So that to me was progress. I just want you to know it could happen to you. They're in their early 20s, but whatever. And actually my other child does it too, and he's in his mid to late 20s. When my children are triggering me, I tell them I'm becoming dysregulated and need to leave the room, and ask them to give me some space. When I'm calm, I'll come talk to them. That's very honest and clear. Teresa says, I say I need to stop this convo for a few minutes. Great. So we want to set a compassionate limit. We don't want to shame them or blame them. We just want to say, stop. I have to gather myself. And that's a reasonable thing. Plus, you're modeling for them how to do it outside of in the world, as well as in the family. Now, LOL progress. Thank you, Susan. They mature. Good job. Thank you. Slowly. Joanna, is it common for neurodivergent people who are dependent on parents to feel repelled and resentful of the caretakers instead of gratitude? Yes. Yes. That's a projection of their own self-hatred. They hate themselves for the dependency that they're exhibiting, and they can't tolerate that hatred, so they're going to project it onto you. So you can put that in a box. You can put your Teflon suit on and not take it in. But if you take it on, you're going to get triggered and then respond to them out of a place of anger, because you're actually holding their anger and then transforming it into your own. So now here's the second question that I want to ask you. What do you say to yourself when you feel triggered? And this is that self-soothing kind of language, of conversation we want to nurture. It's that self-compassionate voice. And I came up with a few ideas, and I want to share them with you. One is, it's okay to feel unsure or uncomfortable. This feeling hurts right now a lot. It will pass if I can tolerate it instead of ignoring it. I can notice my anger, my disappointment, concern, or frustration without acting on it. I can name it and validate it without fixing it. Being human means making mistakes. I'm living and learning. I'm going to regroup and try to figure out what's the next right thing to do. Quit taking it personally. I love this from Al-Anon. Throw in some of your comments here. I want to know what you say to yourself to help you soothe yourself when you're triggered. Christine says, I'm calm, I'm safe. I love that. I love that. I love that. Um, so another one is being real and being good enough are better than being perfect. I'm rooting for me. I've been here before. I have the skills and resources to manage this. Let me settle so I can access them. What can I do to assist myself right now? So put in the chat some things that you say to yourself when you're triggered. And then what you could help your kids say to themselves when they're triggered. Because this is a lifelong tool. And, you know, I'm learning this tool. I'm still learning this tool. You're learning this tool. We are all working on this. And we want to start our kids young to learn how to soothe themselves. Joanna says, I accept what is and thank my discomfort. Maybe I accept what is and thank my discomfort as a teacher. That's interesting. I like that. Anybody else? Anybody else want to share something? What you might say to yourself to soothe yourself? Let's see. Okay. Cassandra, we don't want to be dependent or thought of as helpless. It took me a long time to get over this. I never asked for help for years out of this feeling. I learned that it's okay to need help. So maybe that's something to say. You know, it's okay to ask for help. That's a great thing to say. Let's see. Will this be important in 200 years? I like that. Let's see. What else do we have? Sorry, I'm having a little trouble with my computer. 1 second. Will this be important in 200 years? I'm still working on being aware of my computer. Oy, oy. I'm aware of my emotions rather than lash out and not blame. Thank you, Maria. I'm still working on being aware of my emotions rather than lash out and not blame. Craig says I should pray or meditate. Check in with myself, pause. Leanne, I've learned the MRES, emotional resolution. I feel my physical sensations and give them attention and allow them to change. It's been a powerful tool in my life. Fantastic. I think that's great. Gio says serenity now. That's wonderful. Let's see. Anybody else? Oh, yes. Teresa, do you offer a class on ODD? I don't. I do offer parenting classes on my website, and actually I have a downloadable for y'all today. It's on What's Up with All This Anger. It's just some tips and tools. So check it out from my website. I know there's a lot of resources on ODD, on attitude, and a number of webinars as well. But I do offer parenting classes, and so, you know, and I probably will offer something on managing difficult behaviors in the fall. Sometimes I imagine myself sitting and telling a story to my grandkids, laughing at how silly it would be if I were talking about the current moment, if it's petty or frivolous. Great. I remind myself it's important to travel with happiness. Ooh, that is beautiful. Sarah says, I pray. Stiana, I say myself, slow down, baby steps, baby steps. Fantastic. Maria, I try to take inventory and see if the reason or can I do something to acknowledge my feelings without feeling like I'm being walked on. So you want to acknowledge what's going on without feeling necessarily like you're compromising yourself or giving in to others. I love that. Art helps. Yep, drawing with pastels right now, and it's so soothing. Fantastic. Okay, great. So let's just take a few more minutes. We're going to stop in very soon, but I'm wondering if there are any further questions that you have about triggers, about managing your triggers or helping your kids with triggers. Take a minute and check in with yourself before we end today. Um, uh, let's see. Grazielle, I take time and sit still and just breathe in and out. Wonderful. Sean, this presentation is extremely well done. Thank you, Sean. Thank you so much for this at a time when we have so much uncertainty in the world. Yes, I'm so glad you brought this up because I want to say to everyone, and we have, an international group here, and people may be watching this later who are not in the United States. This is a very uncertain time in our world, and we're all worried and concerned about the welfare of people who are under attack in the Ukraine. I know I'm sending them my prayers, and I'm sending the world prayers for peace. I hope that in our community here we can hold that light. Thank you so much for joining me. You're welcome, Dana. I appreciate your saying that. Tanya, how would it be would be a good approach to bring this up with my parents? I would sit down and say, I want to have a little family meeting to talk about a few things. Go to that meeting prepared with some of your notes from today's Facebook Live. You're welcome, Heather. Thank you. Yes, greetings from Suriname, South America. Thank you, Grazielle. Deanna, my 14-year-old says her brother, who is 10, constantly triggers her. I'm sure he's annoying to her, so we need to help her figure out, brainstorm some ways to respond that aren't just out of anger. You're welcome, Leanne. Thank you for saying that. Erin, okay, you're asking about how to stop crying. So, a lot of times women cry when we're angry. We have these intense emotions, and they manifest as tears because we as women are not taught that it's okay to be angry. And so I think when you're dealing with a hostile coworker, you absolutely need one phrase in your back pocket, probably two. One might be, "Excuse me for a minute, I'll be back." And two is, "I don't want you to talk to me that way. You may not speak to me that way." Asserting your boundary and your power is really important when people are hostile, because if you cry, that you're giving them over a piece of you, and they don't deserve it. Oh my gosh, there are a few more comments. Thank you so much. You're welcome. Sunshine and blessings to you. Thank you, Tanya. I hope you do. You're welcome, Joanna. Thank you, Attitude. Thank you, Maria. Peace and blessings to us all in the next week. I look forward to seeing you then. Thank you for joining me. My heart goes out to all of you. Thank you. Thank you so much for being here.